Welcome to Washington Hospital Today, dedicated to informing residents about healthcare topics and issues. Through programs featuring community forums and free health and wellness classes, our goal is to empower community members with the information needed to make informed health decisions. Washington Hospital has been providing healthcare to the residents of the Washington Township Healthcare District for the past 60 years. Today's presenter is Catherine Dow. Dr. Dow is a cardiologist and practices medicine with the Washington Township Medical Foundation.
I'll be talking a little bit about heart disease in women. I'd like to start off by defining the problem, how big a scope this is, and discuss some differences in the way heart disease presents in men and women, and then go into a description of risk factors to let you know how one might know that they are a risk and what they can do to minimize the risk. So heart disease is the leading cause of death in both men and women. Half of women will have heart disease in their lifetime, and more than 500,000 women die of heart disease every year. This is more than lung cancer and breast cancer combined. It's actually 7 times more than breast cancer. There have been improvements in diagnosis and treatment of heart disease since the 1950s, but since 1984, more women than men die each year of heart disease. And this is because heart disease in women is often underdiagnosed and undertreated. So why is this the case? There are many different reasons. I've outlined a few. Women seem to be more likely to have risk factors for heart disease like obesity, high blood pressure, and high cholesterol. Women are less likely to know that they have heart disease. And sometimes their complaints are not taken seriously, either by their doctors or sometimes by themselves. They often are the caretakers of their families, their husbands, their parents, their children, and they don't prioritize their health. And also, women can present differently than men. So symptoms can be different. The most common symptom of a heart attack in both men and women is chest pain. This includes chest pressure, discomfort, heaviness across the chest, often described as something sitting on your chest where you can't take a great breath in. But women are more likely than men to have other symptoms other than chest pain. They often have non-specific symptoms that make it more difficult to diagnose. This can include difficulty breathing, feeling really tired, indigestion or nausea, back pain or arm pain. It's unclear why women and men often have different symptoms, but there are many differences in men and women, and some of them may explain why there are differences in the presentation. This includes anatomical features. Obviously, men are usually larger in build than women. The women's heart sizes are usually smaller than men's. The arteries, the vessels in the heart, can be smaller in women than men. Their hormonal differences can play a role. Estrogen is predominantly influential in women and testosterone in men. And there are some physiologic or cardiovascular function differences. Women have reduced sympathetic responses, which is the fight or flight reflex than men. Women can have increased heart rate and increased cardiac output at baseline than men. ECG findings, or the EKG, can be different as well. So when you're thinking about heart disease and your risk of heart disease, you should be thinking about your risk factors. And there's 2 types of risk factors that I counsel my patients on. There are first non-modifiable risk factors, ones that cannot be changed. They're ones that you're born with. You cannot change it, but you need to recognize it. And if you have the risk, be aware of it. So age, as people get older, plaque starts to develop in the arteries of the heart. And then the older you get, the more plaque eventually you can develop. Family history is also very important, and when I talk about family history, I'm talking about first-degree relatives who have had heart disease at an early age. So this would include a male relative, like a father or a brother who have had a heart attack before age 55, or a mother or sister who has had a heart attack before age 65. So there is an age difference between when men and women tend to present with heart disease, and it's thought to be related to the protective effect of estrogens. Then there are modifiable risk factors. They're the risk factors that you can actually do something about. And a lot of my talk will center on things that you can do to try to improve your risk. So most risk factors, luckily, are preventable and treatable. They include high blood pressure or hypertension, smoking, high cholesterol or low good cholesterol, diabetes, and obesity. And this is particularly in women who have increased waist circumference, about 35 inches. In my clinic, I see patients who have established heart disease and patients who are at risk for heart disease. And so when you're thinking about your risk, the high-risk patients are the ones who already have established heart disease. They've had established coronary artery disease, including a prior heart attack. They've had a history of stroke. Maybe they have peripheral vascular disease, which is similar to coronary artery disease, but it's plaque that's located in the arteries of the arms and legs, kidney disease, and diabetes. At-risk individuals are ones that don't have coronary artery disease or heart disease diagnosed, but they have the risk factors. So they have high cholesterol, they might be smoking, they have high blood pressure, they're inactive, they have a poor diet, they have a family history of early heart disease, they are already known to have calcium in their arteries. When you are trying to prevent heart disease or prevent the progression of heart disease, you can really change these modifiable risk factors. You can target these risk factors and improve your risk. And you'd be actually really surprised to know how much changing some lifestyle factors can improve your overall risk. Smoking is the number one thing women can do to improve their cardiovascular risk. It's actually declined amongst older women, but younger women are still smoking. And women who smoke are 2 to 6 times more likely to suffer a heart attack and 2 to 3 times more likely of dying of a heart attack. Just 1 to 4 cigarettes a day can double a woman's risk of heart attack. But there's hope. After 10 to 15 years of quitting, former smokers have reduced their risk of heart attack to the equivalent of that of a woman who has never smoked. So if you're smoking, the time to do it is now. If you smoke, you should stop. And obviously it's very difficult to just stop a habit that you're so used to doing. So there's different tips that I've include picking a quit date, including your close ones in the process, include your partner, your family, or friends, join a support group, consider behavioral therapies or hypnosis, and there's also pharmacologic therapies like nicotine replacement and medications that your physician might be able to prescribe for you if you're smoking. The next risk factor is high blood pressure. So high blood pressure is a very prevalent condition in America. 1 in 3 Americans have high blood pressure or hypertension. And I've outlined what was considered now to be normal versus borderline to high. Normal is less than 120/80. The top number is the systolic number, and the bottom number is the diastolic number. High blood pressure is now defined as 140/90. This in-between stage, actually some of the guidelines have recently changed where type 1 high blood pressure is greater than 130/85. People with borderline or type 1 high blood pressure really need to start thinking about lifestyle changes to improve their blood pressure. But once you are in the high range, you should start thinking about medications for treating your blood pressure. I call, and many people call blood pressure hypertension a silent killer. And that's because many people have high blood pressure and they don't realize it. A lot of times people are asymptomatic. You don't realize that your blood pressure is high because you don't feel poorly. It's not until your blood pressure is very, very high that you might start to feel some symptoms. So it's important to really know your numbers to start checking your blood pressure regularly. I recommend checking at least once a week. Getting a cuff where you're checking on the upper arm as opposed to the wrist, because that's generally a more accurate reading, and tracking your numbers. The majority of patients who have high blood pressure and are being treated with medications are not at goal. So your goal should be less than 120/80. If you do have high blood pressure, there are different things, including medications, that you can do to improve your numbers. I mentioned tracking your progress, and then developing healthy habits for eating well and staying active, exercising regularly, limiting sodium in your diet, limiting excessive caffeine and alcohol. limiting serving sizes, increasing your physical activity, and losing weight or maintaining a healthy weight. Cholesterol is another modifiable risk factor. Really, you should know your numbers. The total cholesterol should be less than 200. If it's higher than 240, that's too high, and this range is considered borderline. Glucose is also another risk factor that you should be aware of. Normal fasting blood sugar should be less than 100. When you're over 126, you already have diabetes. A lot of patients have pre-diabetes, and so they don't necessarily need to be on medications, but they need to start having a healthier lifestyle to improve their numbers. So you can take action. 40% of women above age 20 have elevated cholesterol, and the goal really should be less than 200. LDL, which is the bad cholesterol, less than 100. This can be determined by genetic and diet. Lifestyle changes can really improve your numbers. Exercising again, weight loss, healthy diet, and medications if necessary. When I talk about diet, there's some specific tips that you can include in your diet to improve your risk. Adhering to a Mediterranean or heart-healthy diet, and this includes one that's high in fiber, plant-based foods. So green vegetables, beans, legumes, whole grains, quinoa, brown rice. Eating lean protein from nuts, chicken, and fish, and really limiting the fatty meats, red meats, bacon, to only a few times a month. Avoid high-fat dairy like butter and cheeses. Limit processed foods, saturated fats, trans fats, things with added sugars and sodium. Exercise and physical activity is very important as well. This can improve your heart health, your bone health, and mental health. It can improve your self-esteem and improve your sleep. It helps the heart become more efficient. It can lower the blood pressure, cholesterol, and stress. I urge everyone to get up and be more active. In terms of guidelines, cardiologists recommend 150 minutes of moderate intensity exercise a week. This roughly translates to about 30 minutes of moderate intensity exercise 5 days a week. This would include things that get your heart rate up. Jogging, hiking, going up hills, more than just a leisurely walk. You really want to try to break a sweat and do something that will get your heart rate up. You could also try 75 minutes of vigorous intensity exercise. This would include muscle strengthening activities that involve major muscle groups. So cycling, swimming, hiking. In terms of tips, clearly we all need to do more exercise. Sometimes people ask me, can you ever do too much exercise? And there, of course you can. But most people are not doing too much exercise. Most people need to do more exercise. And so it can be challenging, but tips would include thinking about ways to bring exercise into your life, because when you're thinking about it, you're more likely to do it. You should be choosing activities that you enjoy. Find a partner to work out with. Maybe use technology, music playlists, a smartphone app, a wearable or a fitness tracker. And when you're exercising at home, plan ahead. So give yourself plenty of space to work around. Gather the equipment before you begin, like hand weights, jump rope, resistance bands. Sleep is also a very important factor in cardiovascular health because chronic lack of sleep can double the risk of heart disease. There's a condition called sleep apnea that is very common amongst the general population and can increase a person's risk for hypertension, arrhythmia, and other cardiovascular disease. What happens is when people are in very deep stages of sleep, their muscles become very relaxed. And so the muscles that hold up the airway in the throat, the tongue, they collapse and they can lead to chronic decrease in oxygen levels in the blood. It's not severe, it can be chronic. And so over time, this leads to increased stress hormone that circulates in the body that can increase the blood pressure, increase cardiovascular risk, increase risk of arrhythmia. It increases overall strain on the heart and makes the heart work harder. So I often encourage people who might have symptoms of sleep apnea to get evaluated by a sleep medicine professional, and they can monitor your oxygen levels while you're sleeping and diagnose you with sleep apnea. If you have sleep apnea, you should get treated for it. The treatments include weight loss, and also things like a face mask when you're sleeping, which will blow air into your face while you're sleeping. Goal should be 6 to 8 hours of sleep. Some of the symptoms of sleep apnea that you might recognize are waking up with headaches, waking up with feeling like you're not having a refreshed sleep, waking up a few times in the middle of the night thinking that you might have to use the restroom, but actually it's because you're waking yourself up because you're not getting enough oxygen, and just feeling very tired throughout the day. So if you have any of those symptoms, you should get checked out for sleep apnea, and if you have it, you should get treated for it. Another important topic that a lot of people don't recognize or is often overlooked is emotional and mental health. This can play a very big role in cardiovascular health. Unfortunately, mental health issues are often underappreciated, but depression and anxiety are linked to heart disease. It seems that depression and lack of social support are more common among older women. The reason that it is linked to heart disease is because stress can increase levels of stress hormone that circulates through the body, increase blood pressure and heart rate. It can lead to sedentary behavior. It can lead to also other ailments like problems with sleep, headaches, back pain, neck pain, palpitations, and it can lead to unhealthy behaviors. So if you have a lot of anxiety or depression or other stressful issues, you really need to identify that and get treated for it. First, just having awareness, recognizing that there is an issue and addressing it head on. Then developing strategies for coping with mental health disorders. It's important in this day and age to really forget trying to be so perfect. Everyone wants to have a perfect life or do everything great, but sometimes good is good enough. You need to understand what is making you anxious and address those issues directly. There are also different tools that you can look into to try to improve your stress, which include relaxation, meditation, and yoga. And there are actually a lot of classes offered at the Wellness Center here at Washington that you might be able to enroll yourself in. Finding a hobby or doing something on a regular basis can also help with stress management. Sometimes professional help is necessary. Sometimes you can't do it all. There are different mental health professionals who can help, and there are different techniques or therapies that have actually been proven to improve cardiovascular risk. This includes cognitive behavioral therapy, or CBT. This is a type of psychotherapy that involves teaching the individual to reframe their thoughts. So when you have negative thoughts, that can impact how you feel and impact how you subsequently do physically. When you can learn to identify these negative thoughts and reframe them in a positive way, this can affect how you feel and how you do. So CBT allows you to identify triggers and reframe the negative thoughts. There's also mindfulness-based stress reduction, or MBSR, and in this type of therapy, the goal is to increase the awareness of your body functions, feelings, and consciousness. And by doing some meditation and MBSR, you can alleviate anxiety, stress, and depression. Also, looking at your relationships are important because healthy habits spread through your social network. Bad lifestyle choices, like company, and your social circle will influence how you do. Women who regularly spend time with close friends live longer and have less heart disease. So, it's important to assess the close relationships in your life. Find and build a supportive network. If you are in any kind of toxic or unhealthy relationship, and disengage from them. Embrace the ones around you who are truly supportive of what you do, and also do your part. Listen and actively engage with your partners. You can be the change not only for yourself, but your family and friends. So family and friends are more likely to lose weight when a person close to them starts to make positive life choices like diet and exercise. So you really can impact the people around you as the people around you impact you. Making lifestyles can really reverse the progression of heart disease and reduce your chances of heart attack or stroke. And now is the time. It's really never too late to start taking care of your heart. You first need to empower yourself. You need to think actively and proactively, learn about your condition, treatment options, and take the steps that you need to take to make your therapy a success. Take responsibility for all you can do to positively affect your health. When thinking about your risks, set realistic goals. Focus on one single goal at a time. A lot of people have multiple risk factors. But behavioral changes are small and incremental and require positive enforcement every step of the way. And a lot of the times, the reason why diet and exercise can be so hard to maintain is that there's a lag between how you feel and the results. So it's difficult to sustain a motivation. Really set realistic goals. Plan ahead. Know when and where and whom you're going to be doing the new behavior, and focus on what you are going to do rather than what you won't do. Make this most of your doctor's visits. Write down a list of your concerns before an appointment, then ask your most important questions afterwards. The take-home points of my talk are that heart disease is the leading killer among women. Women may present differently, and so it's very important to recognize your symptoms when they occur. It's never too late to change your health habits, and now is the right time to start paying attention to your health. And you can lower your risk for heart attack and stroke no matter how old you are by knowing your risk factors that affect your heart. Know your risk in numbers. Try one thing at a time. Set realistic goals. And don't be afraid to seek medical attention if you need it. Be your own advocate. So if you know that something is wrong, don't accept no for an answer. Let your doctor know. Go to a different doctor if there's something wrong and that doctor doesn't seem to believe you. And lastly, make sure the relationships around you are supportive. Engage loved ones into making healthy choices, and your actions may have a positive effect on the people around you.
Okay, at this time we'll take questions and answers.
That's a two-part question. So coronary calcification, what is that? As people get older, and if they have a lot of risk factors, plaque can start to develop in the arteries of the heart. And plaque will include cholesterol, fatty deposits, fibrous tissue. And over time, that plaque can become calcified. So coronary calcium doesn't necessarily mean a blockage, but if you have a lot of coronary calcium, that makes your risk of developing blockages higher. There's no clear way of reversing the calcium once it forms, but you can do what you can to prevent calcium from developing, and that includes all of the things that I highlighted in my talk. And in terms of dietary calcium, like calcium pills, it's pretty unclear how directly that's linked to coronary calcium. So your primary care doctor might recommend calcium for your bone health, and it probably is okay, or at least we just don't know. If you have osteoporosis or have had fractures, calcium is very helpful. But if you don't have that and you have a lot of coronary calcium, maybe it's not necessary to take too much supplements. It's not clear the exact numbers or the exact proportions. So. And your second question was metabolic syndrome. So what is metabolic syndrome? It's a condition that encompasses a whole slew of diagnoses. So somebody is overweight, they have an increased waist circumference, they have low HDL, which is good cholesterol, high blood pressure. That is a condition that's highly linked to coronary artery disease, and so medications can help improve it, but also lifestyle. So if you're overweight, you have high cholesterol, changing your diet, exercising more, those can all improve your risk. So I would like to stress that chest pain or pressure, heaviness in the chest, is the most common symptom that is presented, and so both men and women can have this. Women will have this more than the other symptoms, but there are a lot of non-specific or other symptoms that women can present with, which make it very challenging to really know what's going on, because they sometimes can just be unrelated. So things like difficulty with your breathing, feeling indigestion or acid, having arm or back pain, just feeling extremely tired, maybe feeling lightheaded or dizzy. So I usually counsel patients that you really should know your body, know yourself, exercise regularly, have a baseline, know what's normal for you. And then when you start having symptoms that are abnormal, you know that they're very unusual and you feel badly, you know something's wrong, that's when you should go seek medical attention. And if you know something is wrong and you're just dismissed by your primary care doctor or whatnot, don't take no for an answer. Go to a cardiologist, go to the emergency room if you really know that something's wrong. And then the necessary tests can be done, and maybe we'll find that actually there's nothing wrong, but at least you need to be your own advocate for that. Palpitations are a condition where people may feel an irregularity in their heartbeat. They might feel that their heart's racing or their heart's skipping a beat. They may feel something's off rhythmically. So that's just a symptom. Atrial fibrillation is a arrhythmia that occurs in people. It's the most common arrhythmia in older people, and it's a chronic condition that can increase over time. And as people age, their risk of atrial fibrillation increases. It can be either paroxysmal or intermittent, which means that it can come and go, or it can be chronic, where it happens all the time. What happens is the top chambers of the heart, which are called the atrium, can start to beat erratically or abnormally. And this can be caused by a lot of different things. Usually people have risk factors like age, they're obese, they've had other conditions like high blood pressure for a long time, diabetes. Or it can just be something that's set off due to a stimulus, something that's a stressful situation like a pneumonia, surgery, having cancer. So these can all put stress on the heart, and the heart starts to beat very erratically and in an inefficient manner. So the heartbeat can be very fast and irregular, and it can lead to feeling poorly, so feeling palpitations, or sometimes just having more vague symptoms like tired, out of rhythm, out of breath. And over time it can lead to heart failure, and the main thing that we worry about is stroke, because when your heartbeat is beating irregularly like that, clots can form in the chambers of the heart because the heart is not beating efficiently, and those clots can go off to your brain and lead to a stroke. So people who have atrial fibrillation, if they have a lot of other risk, need to be on blood thinners to try to reduce their risk of forming clots to prevent the strokes from happening. And then treatment for the atrial fibrillation can include medications or even procedures if you're a candidate for it. And a procedure would involve an ablation, which is a catheter-based procedure where a specialized physician will put a catheter in the heart, identify the area where the atrial fibrillation is coming from, and get rid of the connections in the heart where it can by using energy to either burn or freeze the tissue. So SCAD is a condition called spontaneous coronary artery dissection, so SCAD. And it's a very rare condition, but it's more common in women than men. And it tends to affect women who are as young as it can happen in anybody, but usually people are either perimenopausal or in their 40s or to 60s, and they present with a heart attack. They actually have the signs of a heart attack. They have the same issues where blood flow is limited in the arteries, and their heart can have damage due to it. What happens is it's not due to plaque buildup in the arteries like general coronary disease, but instead there may be a connective tissue issue where a tear forms in the lining or the wall of the artery, and that tear leads to a sudden blockage of blood flow to the artery into the heart muscle. And so if you have SCAD, you would go to the emergency room. You actually would have EKG findings and laboratory findings that are similar to a heart attack, but it's diagnosed by a angiogram, which is a catheterization, and the imaging looks a little different than what normal coronary disease looks like, so it would be diagnosed that way.
Well, that concludes our program for this afternoon. Thank you, Dr. Dow. Thank you again.
Thanks, everyone. Thanks for coming.